We're looking at doing a comprehensive soft tissue release of the back of the shoulder. Most of the time you're going to release the upper trapezius muscle. If you just swing around over here, let's make sure comprehensive release of the back of the shoulder. If you've got a shoulder, posterior shoulder impingement or something like that, you need to start in the neck. So you need to really release the soft tissue of the neck bilaterally down the inside of the scapula on both sides. You've got to release your rhomboids, your mid traps, your lower traps. All of that is really, really important. Your upper trapezius coming along here. So this is kind of very commonly treated by most therapists. You also need to do a lot of thoracic mobilization for the extension component, right? So you need to really lower the bed down, and you need to get a lot of mobility coming into the thoracic spine. So make sure as part of your soft tissue session or your manual therapy session that you're doing a lot of release to the thoracic spine, however you want to do it. If you want to do specific unilaterals at specific levels, you can do that. That's fine, it's fine. Or you can do it with rotational movements in your hands, no issue at all. But what's really, really important is that you don't miss out your infraspinatus, your teres minor, your teres major, and your lats. We really need to work this posterior area very well, especially looking for tension all the way underneath the spine of the scapula, particularly in this outer section of the shoulder, right at the back of the glenohumeral joint, in the posterior capsule, and where all of the muscles start to develop their tendons and sort of make very non-contractile tissue over there. You've got to really get in and make sure that there's no tension in that area. So start off with your infraspinatus. I like to use a lot of myofascial release. So I know that a lot of people might like to just focus on the trigger points, but the muscle tissue is a unit. So you need to work the full length of all of the muscle. My markings are going to go most likely with my oil, but you really need to get underneath that spine of the scapula and really work it in all the positions. So you can work it in the neutral position, and you can work from the medial border of the scapula and go laterally all the way to the tip. I would normally stand this side and do it, but just to try and stay out of the way, I'm doing it from this side, and you work right into the posterior part of the glenohumeral joint. And when you've done that for a solid amount of time, it'll take 2 to 3 minutes, possibly even as much as 5 minutes, to really work on that infraspin using your myofascial techniques. Good amount of pressure to really work it, but not so much pressure that you see tension in his body. You don't want him tensing up, because that tells you that you're applying too much pressure. It should be uncomfortable, but it should be manageable. He should be relaxed. When you've really worked your infraspin, come down the scapula a little bit further, look along it for your teres minor. Again, focusing a lot on this lateral third posterior part of the shoulder. Look, feel for where your landmarks of your scapula are, and just make sure that you're underneath that spine, that you can feel the lateral border, and you need to feel it kind of disappear into a big, massive muscle in the back of the shoulder. Spend another couple of minutes, 3, 4, 5 minutes, just working on that area, and then come down into your teres major. Start working the teres major. Start looking to get that, feel that lateral and inferior border of the scapula, starting from the medial border, working your way along the lateral border. Just really work into that muscle tissue, and then come down into your lats. Now remember, the lats is coming from very low, and it's really coming up into the back of the shoulder. I'm going to need to get into your way a little bit. But we need to work that, especially if we're looking at swimmers, especially if we're looking at people that use their arms in overhead positions a lot. Get up high into this posterior area, really work into that posterior shoulder, and then make sure that you address it at 90 degrees, because this is going to be a more functional position. You're changing the resting length of the muscle tissue so you can get into the muscle tissue a lot better. I'm really using my thumb and reinforcing it with my other hand, running along that lateral border of the scapula, really getting into teres major, getting up into teres minor, and getting really high up into that infraspin, all the way sort of disappearing into where you can feel the acromion running along there on that lateral aspect of the shoulder. You've got to come right in underneath it, get very far into that sort of fossa, that superior fossa underneath the spine of the scapula, and then come down into the deltoid area, work your posterior deltoid. Again, spending a couple of minutes just working on that tissue. I can feel a nice band of thickened posterior deltoid over here. And make sure that you come down underneath the shoulder, right? We've got to come all the way into this area. This is such an important part of the shoulder. We've got to get in there. Often I find the best way of getting in is to change the position. And depending on how much pain they have, you'll be able to get further into this position. My swimmer's got a very minor impingement to his shoulder, so if I'm lucky I can get him very high up into this position. But if you can still see the lines of the little drawing that I made, you'll see they've changed significantly, right? So in this position where I drew them, they were facing here, and now in this upper position, these fibers have changed their angle significantly. We need to be able to release those fibers in this position. We need to make sure that in a very lengthened position, we've released all of that tissue. So high up in here, you need to come right in underneath that lateral scapula, the lateral border of the scapula. Really release that tissue, coming up into this axilla over here. I mean, you're really going to be in that posterior aspect of the axilla, really releasing along this aspect of the inferior posterior shoulder, coming back up underneath that acromion, just coming into that posterior deltoid, infraspin, teres minor area, just releasing that tissue very, very nicely into there. And make sure you don't forget your trapezius muscle. The long head's coming down and attaching over here. You're using your triceps a lot in sports, so we need to release all of the tissue of the tricep all the way down. And again, if you're able to do it in this overhead position, that's absolutely fantastic, because you can release a lot of the tissue sort of in a very lengthened position. And then coming up into the shoulder, and just make sure that you've released throughout the deltoid over there. So that area is critical. Yes, you need to cover your medial border muscles and your superior border muscles, but these posterolateral inferior muscles, especially coming through this area deep in the back of the shoulder, need to be released as well. So prone position, posterior shoulder release. Done.